Our next speaker is Dr. Sheela D. from India. Will speak on antenatal care through Ayurveda, a practical approach in our theme of women and children's health now.
Our beloved chairs and also the dignitaries here, I have something different that I have to explain rather than the older system that have been explained here. Whatever we tell, whatever we discuss in this closed room, it should be come outside the world for the common people. And when the common people needs Ayurveda, Ayurveda will survive. And Charaka, in its first chapter itself, there was the International Congress. It was done at the Himalaya for the sake of the community epidemics, and there Bharadwaja was adopted and was represented to have the Ayurvedic knowledge. And here, one thing that Dr. Swati had presented here, even though Kerala is a cradle of Ayurveda, as a gynecologist or as surgeons, we are not allowed to practice allopathic medicines. So we are purely Ayurvedic people, and at that time, we had a crisis. Our students, I am a teacher from 81 onwards in Vaidyaraktham Ayurveda College. When I came to the, as HOD professor of gynecology department, joined as the HOD, I had a crisis that the students were not permitted to have maternity practices in allopathic medical colleges or allopathic hospitals. And now the system, and at that time, that crisis made me to interfere into the public, to have the book knowledge to the public. That is the practical experience that I present here with a limited short time. The aim of the project was to utilize traditional pregnancy healthcare for the benefit of the public and to avoid SGA babies, small gestational age babies, that is low birth weight infants, and to promote normal labor. Cesarean is more increasing now, and to have clinical experience, motivate the students on the public intervention of the women issues. It was actually the first aim. I put it in the last because as a teacher, I had to hide myself, my aim first. Okay. And the program was started at March 31st, 2001. It was inaugurated in our college, association with a local body government, that is Velasada Gram Panchayat. It is a local body government. When I have to inquire, go there to have their association, they asked me, we have enough knowledge about your postnatal care, it is okay, but regarding antenatal care, we are afraid of. But I said, before this allopathic medicine came, your ancestors, your mothers have delivered you with traditional care. So simply, you just have your, without any, having any compression, you just have your local body persons who are willing to have antenatal care, Ayurvedic care. So it was inaugurated by the Trichy District Panchayat President. She was a lady. And again, at 2002, we had an association with the adjacent Char Block Panchayat, and also 172 pregnant ladies were in that program. And then we have the feedback, and we have presented to the Trichy District Panchayat a program as Integrated Mother-Child Health Program Ayurveda. And it was Janani Ayurveda project. And Kerala Development Program, it was included in Vanida, that is women program, as a women program also. And 2004, June 1st to March 2005, we have had some medical camps on the public intervention. Block working group formation was done, and survey evaluation of the health status of pregnant ladies, formation of Panchayat working group, not us, it was all done by the public. And monthly antenatal camps were done by us. And this is the calendar, and this is the antenatal medical camps that we have done. And these are the implementation that Dr. Vishwanathan, who is here, and he was the HOD of Kaumaripathan department, and my husband also, and and from 5 doctors, and 10 house surgeons, and 15 students, and ICDS workers have participated in the program. The medicine that we have given, that protocol that we have had, is concise, is precise here. I'm not going into the detail. I'm focusing on the program itself. And antenatal care medicines, third trimester, first trimester, second trimester, and third trimester are enumerated. That the positive responses that we have had from the project was low birth weight infants were not reported from the whole participants. And also, easy and normal delivery of the second stage, they have explained to us. And healthy puparium was another thing that they have explained to us, that we have given the postnatal medicines as the program. And also increased breast milk also they have said. And also healthy infancy also they have reported. And data are like this. I am not going into the data. Okay. And postnatal care program we have had, that is Sudhika Snan for 28 days and Sudhika Aushadha Seva for 41 days, especially Kerala special preparations. That we can have later, the time is not. And at last, we have had 2 Madhur Shishu Sangams, that is Janani mother and child meet, 2006 April 6 and 2011 December 16, and we are planning to have at 2016 also, and at the end of the 15th year. And medical checkup were given, and toys for all the children, and it was a very, very, very pleasant day for our students. And 1 gold coin was given as a lottery method. An extension of the journey program. That is why effect that made a single project to a extended program. That is Women Component Scheme project with refresher courses for doctors and house surgeons who have to participate, and also Prasava Sushruta training for ASHA workers. Now the Ayush department has incorporated it. Thank you. And Mahila Samakhya, with Mahila Samakhya, we had a program at Trivandrum district, and Idukki district, they have 58 lakhs for Idukki department, ISN department they have given, and Wayanad also 72 lakhs they have given for ISN department. And objective is achieved, and it was accepted as a model project in Women Component Program scheme by Kerala government and also ongoing project is randomized control trial for evaluation of Ayurvedic drug in IUGR, and also RCT to assess the efficacy of Dadimadhikrita and Dhanvantartha Piju in normal labor. And these are my paintings on motherhood. Okay, this is the womb, child in the womb, and also this is how rasa goes to breast and the uterus and the self. And thank you very much.
Thank you, Dr. Sheela D. Your work in public health and women's health is very important for the community and society, and certainly public health and community health are important parts of Ayurveda, from the individual to the society.